Hey everyone, welcome back to the channel. If you've ever felt that burning, gnawing pain in your stomach after eating or dealt with constant bloating, nausea, or indigestion, you're not alone. As a doctor, I see gastric issues like gastritis, acid reflux, and bloating almost every day in my clinic. So today we're diving deep into something that can make a real difference for you, the best foods and OTC medications that can coat, soothe, and heal your stomach lining. And stay with me till the end, because I'll also share practical tips, a simple healing meal plan, and common mistakes that might actually be making your stomach worse. Let's begin. Chapter 1. Why your stomach needs protection. Picture this. Your stomach lining is like a soft, protective mattress. But when you have gastritis or acid reflux, that mattress gets torn, inflamed, and irritated by acid. That's why you feel burning, bloating, or discomfort.
What we need to do is 3 things: calm the acid, coat and protect the stomach lining, and heal the damage. So, let's start with how to do that naturally and effectively.
Chapter 2. Foods that coat and heal the stomach. I always tell my patients, food is medicine, and certain foods can literally coat and protect your stomach lining like a shield.
1. Bone broth and clear vegetable broth. Think of this as a warm hug for your stomach. Bone broth is rich in gelatin and collagen, which helps repair the gut lining. The amino acids in broth, especially glycine and glutamine, act as building blocks for mucosal healing. Drink 1 cup warm broth twice daily, especially on an empty stomach.
2. Boiled potatoes and sweet potatoes. Simple, soft, and starchy. These help absorb excess stomach acid and reduce irritation. The resistant starch in potatoes feeds healthy gut bacteria and forms a protective barrier over the stomach wall. Add half a cup boiled potatoes or sweet potatoes to your meal.
3. Aloe vera juice. Aloe vera isn't just for sunburns, it's a stomach healer too. It contains polysaccharides that reduce inflammation, regulate stomach acid, and form a thin mucosal layer inside your stomach. Take 1 to 2 ounces of organic aloe vera juice before meals. Avoid if you have diarrhea, it may worsen it.
4. Manuka honey. This isn't just any honey. Manuka honey contains methyl glyoxal, which has antimicrobial and wound healing properties. It can help form a protective film over your stomach lining, and even fight off H. pylori bacteria, a common cause of gastritis. Take 1 teaspoon daily, preferably before breakfast.
5. Bananas. Bananas contain natural compounds called flavonoids and resistant starch that stimulate mucus production in the stomach, reducing irritation. Eat 1 ripe banana in the morning or as a snack.
Chapter 3. OTC medications for gastric patients. Of course, sometimes food isn't enough, especially when symptoms flare up. Let's talk about the most effective over-the-counter meds you can safely use.
1. H2. Blockers like famotidine. Famotidine blocks histamine receptors in the stomach lining, reducing acid production. Less acid means less damage to the inflamed gastric mucosa. Dosage 10 to 40 milligrams before meals or at bedtime.
2. Antacids like Melanta or Tums. These work like firefighters, neutralizing stomach acid immediately. They buffer the acid, reducing irritation and pain within minutes. Take 1 to 2 tablets after meals or when symptoms occur.
3. Bismuth subsalicylate, also known as Pepto-Bismol. This forms a protective coating over your stomach lining and has mild antibacterial action. Dosage 30 milliliters or 1 to 2 tablets after meals, up to 8 doses per day.
4. Simethicone, found in Gas X or Melanta gas. If bloating is your main issue, simethicone breaks down gas bubbles in your stomach and intestine. Dosage 125 to 250 milligrams after meals or at bedtime. Chapter 4. Natural herbs that soothe the stomach. In my clinic, I've seen so many patients benefit from herbal remedies when used properly. Let's talk about some effective ones.
1. Slippery elm. This herb contains mucilage, which turns into a gel-like coating when mixed with water, like a natural band-aid for your stomach. Mix 1 tablespoon of powder in warm water and drink before meals.
2. Licorice root, deglycyrrhizinated. Licorice stimulates mucus production, enhancing the stomach's protective layer without raising blood pressure. Take 400 to 500 milligram tablets before meals.
3. Chamomile tea. Not only does chamomile calm your nerves, but it also reduces stomach inflammation and mildly coats the lining. Sip 1 cup after meals.
4. Ginger. Ginger's anti-inflammatory and pro-digestive properties soothe the stomach and reduce nausea. 1 teaspoon of fresh ginger or a 500 milligram supplement daily should do the trick.
5. Iberogast. A blend of 9 herbs, Iberogast has been clinically proven to reduce gastric pain, bloating, and inflammation. Dosage 20 drops in water, 3 times a day before meals.
Chapter 5. Doctor's Quick Meal Plan for Gastric Relief. Here's what I usually recommend to my patients when they're struggling with stomach issues.
Breakfast banana, warm oatmeal, and a drizzle of manuka honey.
Lunch plain boiled potatoes, steamed veggies, and bone broth.
Snack chamomile tea and 1 cup of yogurt.
Dinner clear vegetable broth, rice, and boiled chicken or fish.
Before bed slippery elm drink or aloe vera juice.
Chapter 6. Why this works. Here's the science simplified. When your stomach lining is inflamed, acid directly attacks those raw, irritated areas. These foods and remedies do 3 things.
1. Reduce acid production with famotidine, antacids, and boiled potatoes and sweet potatoes.
2. Form a physical barrier with bismuth, subsalicylate, slippery elm, broth, and bananas.
3. Promote mucosal healing with ginger, chamomile tea, licorice, aloe, and honey. Think of it like patching up a damaged road. You need to stop the traffic acid, put up protective barriers coating foods, and repair the cracks healing foods and herbs.
Chapter 7. Quick recap and doctor's advice. So, here's your action plan. Eat stomach-coating foods daily. Use OTC medications during flare-ups. Add herbal remedies consistently for healing. Avoid spicy, greasy, acidic foods. They damage your stomach further. And here's my question for you. What's your go-to home remedy when your stomach feels upset? Drop your answers in the comments below.
If this video helped you, don't forget to hit that like button, subscribe for more doctor-approved health tips, and share this video with anyone struggling with gastric problems.
Stay healthy, stay happy. I'll see you in the next video.